Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Today we are going to continue with the first chapter of renal physiology. So far we have discussed the functions of the kidney and the physiological anatomy of the kidney. We have discussed the blood supply of the kidney and how it is unique, having two capillary beds, the glomerular capillaries and the peritubular capillaries. We also discussed the structure of nephron and two types of nephron, the cortical nephrons and the juxtamedullary nephrons. So let us now begin with the micturition and the micturition reflex. So what is meant by micturition? Basically, micturition is the process by which the urinary bladder empties itself after it becomes filled. So in common terms, we can call it urination, and it involves two important steps. First of all, the bladder becomes to fill progressively with urine until the tension within its walls rises above a threshold level, a certain level, and after this the tension elicits a nervous reflex which leads to the emptying of the bladder, or at least it causes a conscious desire to urinate, and this is known as micturition reflex. So the two important steps are कि पहले bladder fill होना शुरू होता है, यहाँ तक कि वो एक threshold level तक fill होता है और bladder की walls की tension जो है वो बहुत high हो जाती है, और जब इस threshold level को tension achieve कर लेती है तो अब एक रिफ्लेक्स जो है वो एलिसिट किया जाता है, स्टार्ट किया जाता है, जिसके नतीजे में या तो ब्लैडर एम्प्टी हो जाएगा, वरना अगर एम्प्टी नहीं भी हो सकता तो एक कॉन्शियस डिज़ायर जो है वो प्रोड्यूस होगी टू evacuate the bladder or empty the bladder, and this is known as the micturition reflex. And this is an autonomic spinal reflex, which means it is an automatic reflex which is controlled by your sympathetic and parasympathetic nervous system, but the final act of micturition or voiding of the urine is controlled by the higher centers. It is facilitated by the higher centers. So it is basically an autonomic reflex which is controlled by the sympathetic and parasympathetic nervous systems, but the final act of emptying the bladder into the external environment is controlled by the higher centers. इसको हम आगे डिटेल में स्टडी करेंगे, so you will understand what I mean. Let us now continue with the physiological anatomy of the bladder. First, you need to understand the anatomy of the bladder. It consists of two parts, the body and the neck. So the body is where the urine is collected, and the body then funnels down into a narrower path which is known as the neck, and it is the neck which is connected to the urethra, and urethra is the tube which opens into the exterior of the body through which micturition occurs. So this is the physiological anatomy of the bladder. The bladder is made up of smooth muscles. You must remember that the bladder is made up of smooth muscles. That is why it is under the control of autonomic nervous system. And these muscles have a special name. They are known as detrusor muscles. They are known as detrusor muscles. And these muscles, cells, they extend in all directions. They make a meshwork, and this is the reason they form a very टफ स्ट्रक्चर. ये एक दूसरे के साथ क्रिस क्रॉस हुए होते हैं हर डायरेक्शन के अंदर, ताकि ये एक स्ट्रॉन्ग स्ट्रक्चर बना सकें, सिंस ब्लैडर हैज़ टू फेस अ लॉट ऑफ हाई प्रेशर्स एंड इट हैज़ टू बी स्ट्रॉन्ग. दैट इज़ वाई it has a very tough wall which is made up of smooth muscle fibers which extend in all directions, and this arrangement of fibers of the smooth muscles of bladder allows strength, एंड इससे ये होता है कि ब्लैडर के अंदर कोई टेयर नहीं आ सकता और डैमेज नहीं हो सकता. And this is also responsible for the high pressures which can be achieved during contraction, such as up to 40 to 60 millimeter mercury. यही arrangement जो है fibers की ये help करती है bladder को इतने high pressures तक contract करने में. This special arrangement is responsible for these high pressures during contraction. Also, the smooth muscle cells are fused to each other, and they have special gap junctions between them which allow the action potential to travel from one smooth muscle cell to other smooth muscle cells, so they can all act as a syncytium. They can contract together, so all of the bladder can contract at once. So the smooth muscles, they are attached to each other through gap junctions, so that when the action potential is traveling from one smooth muscle cell, it can also travel into another smooth muscle cell, and they all can contract together and contract as a syncytium. So this is all about the structure of the bladder. Another thing that you must know is there is a special triangular area which is present inside the bladder, and it is known as a trigone. And how can you identify the trigone? The trigone does not have the typical mucosal foldings of the bladder wall. यहाँ पर आप देख सकते हैं कि बाकी bladder wall के अंदर ये mucosal foldings हैं जिनको रूगी कहते हैं, but this area trigone is free of these mucosal foldings and it does not contain the rugi. It is in the shape of a triangle, so its apex lies towards the neck of the bladder and it opens into the posterior urethra, while the base of the trigone is the area where the ureters open. ठीक है, तो ये एक इन्वर्टेड ट्रायंगल की शक्ल में होता है. इसकी जो एपेक्स है वो यूरिथ्रा में ओपन हो रही होती है और जो इसकी बेस है उसके दोनों एंगल्स के ऊपर जो है आपकी यूरिटर्स जो हैं वो ब्लैडर के अंदर एंटर होते हैं और ओपन होते हैं. सो दिस स्ट्रक्चर इज़ नोन एज ट्राइगोन. लेट अस नाउ डिस्कस द स्फिंक्टर्स विच आर प्रेजेंट विद इन द ब्लैडर. The bladder consists of two sphincters, the internal sphincter and the external sphincter. Let us first discuss the internal sphincter. First you must remember what is a sphincter. Sphincter कोई ख़ास यहाँ पर कोई अलग से body नहीं attached होती. It is the thickening of the smooth muscle of the bladder interlaced with large amounts of elastic tissue. So जहाँ पर bladder end हो रहा होता है और नेक में कन्वर्ट होकर यूरिथ्रा से अटैच हो रहा होता है, वहाँ पर जो स्मूथ मसल्स हैं वो थिकेंड होते हैं और उनके अंदर इलास्टिक फाइबर्स मौजूद होते हैं और ये मिलकर एक स्फिंक्टर बनाते हैं जिसको कहते हैं इंटरनल स्फिंक्टर. सो द इंटरनल स्फिंक्टर is present at the neck of the bladder. Here the urinary system which is shown over here is the system of a male, because you can see prostate over here and you can see the penile erectile tissue over here. So this is how the urinary system is arranged within a male. This bladder, where it narrows down and is continued down as the urethra, at the junction of the urethra and the bladder, the smooth muscle cells form a thickening along with elastic fibers, and this forms a sphincter. This is known as the internal sphincter. And remember that it is involuntary. It is not under your control. It is under the control of your autonomic nervous system. तो आप इसको याद रखने के लिए याद रख सकते हैं कि I for internal and I for involuntary. So your internal sphincter is involuntary. It is not under your conscious control. It is under the control of your autonomic nervous system. So naturally the internal sphincter is closed and it keeps the neck of your bladder closed so that the urine does not leave the bladder and enter into the urethra, and it is only open when your autonomic nervous system sends signals to it. and when the micturition is about to take place. At all other times, it maintains its tone, and it shuts this pathway between the bladder and the urethra, so the bladder cannot empty into the urethra. Now let us move on to the external sphincter. The external sphincter is basically formed by the muscles of the urogenital diaphragm, which is present around the urethra. So meant by the urogenital diaphragm, it is basically a thick sheet of muscle which forms the floor of your pelvis, and all your structures of the pelvis lie above the urogenital diaphragm. It is formed of skeletal muscles. Okay, it is formed of skeletal muscles, it is not formed of smooth muscles. So this is the diaphragm which is pierced by all the openings of your body. For example, your urethra opens, passes through the urogenital diaphragm and opens into the external environment, and your rectum has to pass through the urogenital diaphragm and open into the external environment. तो ये तमाम जो openings हैं body की, जैसे कि urethra और जो आपकी anal canal और rectum है, these pass through this muscle sheet which is known as the urogenital diaphragm and then open into the environment. और ये thick skeletal muscles जो हैं, ये इन openings के इर्द गिर्द जो है एक sphincter बना देते हैं, and this sphincter is under your voluntary control. ठीक है, तो let me repeat that the external sphincter is formed by the skeletal muscles of the urogenital diaphragm. What is the urogenital diaphragm? It is basically the pelvic floor, the floor of your pelvis, and it is made up of skeletal muscles, and it is pierced by all the tubes which are to open in the external environment. For example, it is pierced by the urethra, it is pierced by the rectum, and when the urethra is passing through the urogenital diaphragm, it can be closed off by the contraction of these muscles. So these muscles form the sphincter. और ये एक्सटर्नल स्फिंक्टर जो है ये आपके वॉलंट्री कंट्रोल में होता है. इट इज़ अंडर योर कॉन्शियस कंट्रोल लाइक ऑल अदर skeletal systems. So here you have your internal sphincter, which is formed by the smooth muscles of the bladder and elastic tissue, and it is involuntary. And here you have the external sphincter, which is formed by the skeletal muscle of the urogenital diaphragm, and like all other skeletal muscles, it is under your voluntary control. So what is the function of the external sphincter? It consciously prevents urination even when involuntary control is attempting to empty your bladder. Suppose your bladder is filled and there is a very strong urge to micturate, your bladder is contracting under the control of your autonomic nervous system, even your internal sphincter is being pushed open because of the contractions. But if you see that the environment is not appropriate, there is no washroom available, you can consciously constrict your external sphincter, and this will help you to retain your urine and not void it. And this is the main function of the external sphincter, that it can consciously prevent urination even when the urge to micturate is very high and your autonomic nervous system is trying to empty your bladder. So here in this figure you can see the male and female urinary systems, and they for comparison you can see that the female bladder empties into a short urethra. This urethra passes through the urogenital diaphragm and opens into the exterior. And here you can see the male urinary system, a urinary tract. The bladder empties into the urethra, which first passes through the prostate gland. You know, the prostate gland is a gland which is present in the males, and it is responsible for the activation of sperm. And the urethra first passes through the prostate gland, then it pierces the urogenital diaphragm, as you can see over here, and continues into the penis, and this area is known as the penile urethra. So this is the difference between the male and female urinary tracts. Let us now discuss the innervation of bladder. This is a very important topic and you might be asked several questions from this topic, so please be attentive. First of all, your urinary bladder is supplied by two types of nervous systems. First of all, it is supplied by the autonomic nervous system, which comprises of the sympathetic and parasympathetic nerves. And as you know, the autonomic nervous system is not under your conscious control. And it is also supplied by the somatic nervous system, which is under your conscious control. So your autonomic nervous system supplies the bladder wall and the internal sphincter. It comprises of parasympathetic and sympathetic nerves. First, we have the parasympathetic nerves, which arise from the S2, S3 segment of your spinal cord. These nerves are also known as pelvic nerves. So P for parasympathetic and P for pelvic, ये आपने याद रखना है. Your parasympathetic nerves arise from S2 and S3 and are also known as pelvic nerves. Your sympathetic nerves arise from the L2 segment or the lumbar segment of your spinal cord, and these nerves are known as hypogastric nerves. So you must remember बेटे कि ये आपका fight and flight system होता है sympathetic nervous system, and your parasympathetic nervous system is your rest and digest nervous system. So you must remember that to micturate or to pass urine, your parasympathetic nervous system must be activated or involved, क्योंकि ये मिक्चुरेशन, डेफिकेशन, डाइजेशन, ये तमाम प्रोसेसेस जो हैं ये रेस्ट के और के टाइम पर होते हैं ड्यूरिंग पैरासिम्पथेटिक एक्टिविटीज़. These are parasympathetic activities. They are not related to fight and flight. So the nerves which will be involved are the parasympathetic nerves, and your sympathetic nervous system is involved with the storage of urine. ठीक है, तो इसको याद रखने का तरीका क्या है कि S for sympathetic and S for storage of urine, and P for parasympathetic, and as the name indicates, P. ठीक है, it allows you to pee or micturate as the kids call it. So you must remember that parasympathetic are involved in micturation and sympathetic is involved with storage of urine, and it stops the micturation process. And as for the pudendal nerve, which is your somatic nerve, it supplies your external sphincter, which is under the control of your higher conscious centers, and pudendal nerve normally keeps your external sphincter closed or tonic condition, and it is only when the conditions are favorable and you have the facilities of a toilet, or you have appropriate social environment to micturate, that is when your higher center is going to inhibit your pudendal nerve signals to the external sphincter, and then your external sphincter will relax, and the voiding or micturation or urination can take place. So let us now see this in a figure form. Here we have the bladder, and as you can see, it is being innervated by parasympathetic, sympathetic and somatic nerves. First let us discuss the autonomic nervous system, which is supplying the bladder. यहाँ पर आप देख सकते हैं कि from the sacral region S2 and S3 arises the parasympathetic nerve, which is also known as the pelvic nerve. ठीक है, तो parasympathetic P से P ही से pelvic nerve, जो कि इस nerve का नाम है, and what it does, it helps you to pee or micturate. So this is a mnemonic which can help you remember the name and the function of the parasympathetic nerves. So these nerves, parasympathetic nerves, supply the walls of the bladder. Pelvic nerve supplies the walls of the bladder. and it causes contraction of the bladder wall during micturition. Then we have the sympathetic nerve, which arises from L2 region. It is known as the hypogastric nerve, and what it does is it supplies the internal sphincter and it keeps it constricted, so it prompts or causes the storage of urine. It does not allow the bladder to empty, and that is what is the function of the sympathetic nervous system. It is fight and flight conditions. ठीक है, you do not have the luxury to micturate or relieve yourself. जब अगर आप फाइट एंड फ्लाइट कंडीशन में हो और आपके पीछे कुत्ता दौड़ रहा हो, यू डू नॉट हैव द लग्जरी और द टाइम टू मिक्चुरेट. ठीक है, सो मिक्चुरेशन इज़ एन it is attempted during parasympathetic situations or rest situations. So what sympathetic nerves are going to do, they are going to stop micturition by closing off this internal sphincter, and it causes the storage of urine in the bladder. तो आप कैसे याद रख सकते हैं कि S से sympathetic and S से storage, and it stops micturition. It does not allow the emptying of the bladder. Thirdly, we have the somatic nerves. Somatic nerves वो होती हैं जो आपके कॉन्शियस कंट्रोल में होती हैं, ये ऑटोनॉमिक नर्वस सिस्टम का हिस्सा नहीं होती, और ये जो है ये सप्लाई करती है आपके एक्सटर्नल स्फिंक्टर को, and it is supplied by the pudendal nerve, and pudendal nerve is under your conscious control. Normally pudendal nerve keeps sending signals to the external sphincter and keeps it closed, and when the brain is ready to micturate, when it has favorable conditions, it is going to send signals to the pudendal nerve, and the pudendal nerve is going to stop firing, and the external sphincter will relax and the bladder can empty itself. हम इसको भी आगे डिटेल में भी डिस्कस करेंगे. नाउ here is a review of the nerves. First we have the pelvic nerves, which are parasympathetic in nature. They arise from S2 and S3. They have both sensory and motor components. ये एक इम्पॉर्टेंट बात है जो कि आपको समझनी चाहिए कि जो पैरासिम्पथेटिक नर्व्स हैं ना सिर्फ ये मोटर हैं, ये आपके ब्लैडर की कंट्रैक्शन कराती हैं, बट दे डू हैव अ सेंसरी कंपोनेंट टू. सो व्हेन योर ब्लैडर इज़ फिलिंग विद यूरिन, there are receptors, stretch receptors, which are present in the walls of the bladder, and they detect stretch, and this sensation of stretch is carried to the spinal cord by your pelvic nerve, which is S2 S3. तो ये जो आपकी pelvic nerve है जो कि parasympathetic है in nature, ना सिर्फ ये मोटर है, कंट्रैक्शन कराती है ब्लैडर की, बल्कि ये सेंसरी भी है और आपके ब्लैडर से स्ट्रेच की सेंसेशंस लेकर स्पाइनल कॉर्ड तक जाती है. Then these sensory fibers which detect the stretch in the bladder wall, they carry the signals of stretch from the bladder wall and from the posterior urethra to your micturition center, which is present in the spinal cord, and they play a very important role in the micturition reflex. And through this same nerve, the spinal cord sends back signals to the bladder and cause it to contract. सो सेंसरी फाइबर्स भी इसी नर्व में मौजूद होते हैं जो कि रिले सेंटर में जाते हैं इन द स्पाइनल कॉर्ड, और स्पाइनल कॉर्ड इसी नर्व के थ्रू मोटर सिग्नल्स भेजती है फॉर द कंट्रैक्शन ऑफ द ब्लैडर. Then we have the pudendal nerve. As I mentioned before, it is a somatic nerve and it innervates the skeletal motor fibers of the external sphincter. Thirdly, we have the hypogastric nerve, which is sympathetic in nature. It arises from the L2 segment of the spinal cord. It does not have a very important role in the relaxation of the bladder wall itself. जैसे कि मैंने आपको पहले बताया कि ये सिर्फ ब्लैडर के स्फिंक्टर जो है उसको इनर्वेट करती है और उसको क्लोज्ड ऑफ रखती है when the bladder is not ready to evacuate, और सिर्फ इवैक्यूएशन के टाइम पर ये जो है ये रिलैक्स होती है और यहाँ से यूरिन पास कर सकता है फ्रॉम द ब्लैडर इनटू द यूरेथ्रा. जहाँ तक इसका ताल्लुक़ है ब्लैडर वॉल से, ये ब्लैडर वॉल को कोई ख़ास जो है इनर्वेट नहीं करती. इट डज़ नॉट कॉज द रिलैक्सेशन ऑफ द ब्लैडर वॉल, बट इट डज़ have some sensory fibers which carry pain sensations from the bladder wall, and they can carry some pain sensations, and this is the function of the hypogastric nerve. Here is another figure from your Guyton, which is showing the same innervation of the bladder. Here you can see the sympathetic nerves L2 arising from L2. This is the hypogastric nerve, which mostly supplies your internal sphincter, which you can see over here, and it has some fibers going to the walls of the bladder for carrying pain sensation from the bladder towards the spinal cord. Then you have your parasympathetic nerve, which arises from S2 and S3, and it innervates the walls of the bladder, and also innervates the posterior urethra or the neck of the bladder, and it is mostly responsible for the contraction of the bladder during micturition. And here we have the pudendal nerve, which innervates the external sphincter. Let us now quickly discuss the transport of urine from the kidney to the bladder. As we all know that the urine is formed within the nephron, and all the nephrons drain the urine which is formed into the collecting tubules, and these collecting tubules then drain into the renal pelvis. You can see the renal pelvis over here, and as I mentioned before, renal pelvis is divided into minor calyces which join to form the major calyces, and then they form a large funnel shaped pelvis. So these collecting tubules, they open up into the minor calyces which join to form major calyces. The major calyces then empty into the pelvis, and this pelvis then extends down into the ureter. The ureter then enters the bladder, and as I mentioned before, they open into the interior of the bladder at the angles of the trigone, the triangular area, and from the bladder arises the urethra, and this urethra opens into the exterior, and it is from this urethra the urine is excreted into the external environment. So this is the transport of urine. Let us now discuss ureters. Ureters are basically two tubes made up of smooth muscles which carry the urine from the kidneys towards the bladder. Now you must remember that these ureters enter into the bladder rather obliquely. They do not enter horizontally, they enter obliquely into the bladder. Now they travel through the wall of the bladder for a considerable distance. ठीक है, ये एक तो सीधा एंटर नहीं होती, ये थोड़ा सा ओब्लीक एंटर होती हैं, और ये काफ़ी डिस्टेंस ब्लैडर की वॉल के अंदर ही, थिक मस्कुलर वॉल जो है ब्लैडर की, उसके अंदर ट्रैवल करती हैं, और फिर ये ट्राइगोन के जो एंगल्स हैं उनके ऊपर ओपन होती हैं. ठीक है, ये जो ट्रायंगुलर एरिया है जिसको हम ट्राइगोन कहते हैं, इसकी बेस के ऊपर जो दो एंगल्स हैं वहाँ पर ये ओपन होती हैं यूरेटर्स. सो why do ureters travel obliquely into the bladder? Why not straight into the bladder? And why do they pass through the detrusor muscles for such a long distance? The reason for this is that when the ureters enter into the bladder, they enter obliquely and they travel through the wall of the muscles for a considerably long region and distance. इसका फ़ायदा ये होता है कि जब मिक्चुरेशन के दौरान ब्लैडर कंट्रैक्ट करता है तो ब्लैडर की वॉल्स जो हैं वो स्फिंक्टर के तौर पर एक्ट करती हैं और यूरेटर को क्लोज ऑफ कर देती हैं, एज यू कैन सी ओवर हेयर. दिस इज़ अ रिलैक्स्ड ब्लैडर, and you can see that the ureters are traveling through the walls of the bladder. And now during micturition, when the bladder is about to contract to push the urine into the urethra, the tension in the walls of the bladder cause the occlusion of the ureter. अब इसका फ़ायदा क्या है? फ़ायदा इसका ये है कि जब ब्लैडर कंट्रैक्ट करके यूरिन को यूरेथ्रा की तरफ पुश करेगा तो वो यूरेटर्स को पिंच ऑफ कर देगा, बंद कर देगा, ताकि यूरिन जो है वो वापस travel ना कर सके from the ureters towards the kidneys. So this is the reason the ureters enter at an oblique angle through the bladder wall, and they travel a considerable long distance through the bladder wall until they open to the interior. There are some diseases in which the ureter which is opening into the bladder wall does not travel through the मसल वॉल फॉर एन एडिक्वेट डिस्टेंस. ये देख सकते हैं आप कि ये जो यूरेटर है ये डायरेक्टली ओपन हो रहा है इनटू द ब्लैडर वॉल. इट इज़ नॉट पासिंग थ्रू द मसल ऑफ द ब्लैडर वॉल एंड देन ओपनिंग इनटू द ब्लैडर. अब इसका नुकसान क्या होता है कि देयर इज़ नॉट इनफ sphincter action being provided around the walls of the ureter. अब जब मिक्चुरेशन के दौरान ब्लैडर कंट्रैक्ट करेगा तो वो पूरी तरह यूरेटर को क्लोज ऑफ नहीं कर पाएगा, जिसकी वजह से यूरिन वापस ट्रेवल करेगा towards the kidneys and it can damage the kidneys. It can cause the condition known as hydronephrosis, जिसके अंदर fluid starts to accumulate within the kidneys and causes swelling of the kidneys, and it may even lead to renal failure if it is prolonged and untreated. So the normal tone of the detrusor muscles of the bladder wall compress the ureter and prevent the backflow of urine from the bladder towards the kidneys, which is known as reflux. So the ureters are well supplied with pain nerve fibers. They are very sensitive to pain, and whenever they experience pain, such as when there are present ureteral stones, this results in severe constriction of the ureters. ठीक है, तो ureters जो हैं ये बहुत sensitive हैं to pain, and whenever they experience pain due to stones, it results in constriction of the ureters. Now we should discuss a very important reflex known as the uretro-renal reflex. As the name mentions, the ureters, when they are blocked because of a stone or if they are constricted because of pain, they send signals to the renal artery so that the blood supply to the kidney is reduced and there is reduced formation of urine. Let me explain. Suppose this is the kidney and here we have the ureter which carries the urine from the kidney to the bladder, and suppose there, and here you can see the renal artery which is entering the hilum. If there is an obstruction to the outflow of urine in the form of a stone, suppose यहाँ पर कोई stone है जो कि ureter को block कर रहा है, तो यूरेटर से कुछ सिंपैथेटिक सिग्नल्स जो हैं वो जाते हैं टू द रीनल आर्ट्रियोल विच कॉजेज़ द कंस्ट्रिक्शन ऑफ द रीनल आर्टरी. अब इसका क्या फ़ायदा होगा? जब रीनल आर्टरी कंस्ट्रिक्ट हो जाएगी तो फिल्ट्रेशन भी कम हो जाएगी एंड देयर विल बी रिड्यूस्ड क्वांटिटीज़ ऑफ यूरिन विच विल बी फॉर्म्ड बाय द किडनी. इसका फ़ायदा क्या होगा? क्योंकि वहाँ यूरेटर में ऑलरेडी ऑब्स्ट्रक्शन मौजूद है और यूरिन जो है वो मूव नहीं कर सकता फ्रॉम द पेल्विस टू द ब्लैडर, क्योंकि दरमियान में ऑब्स्ट्रक्शन है. तो इसका नुकसान क्या होता है कि यूरिन जो है वह एक्यूमुलेट होना शुरू हो जाता है इन द पेल्विस और पेल्विस को डायलेट कर देता है और जो है आपका किडनी के अंदर हाइड्रोनेफ्रोसिस हो सकता है और स्वेलिंग हो सकती है. तो इसको अवॉइड करने के लिए रीनल आर्टरी को कंस्ट्रिक्ट कर दिया जाता है ताकि बहुत कम जो है वो GFR प्रोड्यूस हो, फिल्ट्रेशन कम हो, कम यूरिन प्रोड्यूस हो, क्योंकि यहाँ पर ऑलरेडी एक ऑब्स्ट्रक्शन मौजूद है जो कि यूरिन को ड्रेन नहीं होने दे रही. सो पेन इम्पल्सेस फ्रॉम द यूरेटर ड्यू टू द ब्लॉकेज ऑफ द यूरेटर cause reflex constriction of the renal arteriole, thereby decreasing urine output. This prevents excessive flow of fluid into the pelvis of the kidney because of the blocked ureter. So the pelvis is not damaged and the kidneys are not damaged. Here is a table which discusses the innervation of the bladder. As I already mentioned, that the walls of the bladder and the detrusor muscle of the bladder is mostly innervated by the parasympathetic nerves, and parasympathetic nerves are they cause the contraction of the bladder during micturition, and when there is no micturition, these nerves are inhibited and the bladder wall is relaxed and allowed to fill. Then the internal sphincter, which is present in the neck of the bladder, is mostly innervated by the sympathetic nervous system, and it is supplied by the hypogastric nerve, which arises in the L2 region. During the filling of the bladder, the sphincter is constricted because this sympathetic nerve is stimulated. और जब ब्लैडर को एम्प्टी करना होता है ड्यूरिंग मिक्चुरेशन, द सिंपैथेटिक नर्व इज इनहिबिटेड, दिस internal sphincter is inhibited, it relaxes, it opens up, and the urine from the bladder moves into the urethra. Then we have the external sphincter, which is innervated by the pudendal nerve, which is the somatic nerve, and it is under the control of your brain. And during the time of filling of the bladder, जब micturition नहीं होनी, उस टाइम पर pudendal nerve stimulated होती है and it keeps the external sphincter constricted. During the time of the micturition, when the bladder is to be emptied, the pudendal nerve is inhibited and the sphincter relaxes, and this allows the urine to be evacuated into the external environment. So this is just a revision of what we have already studied. So let us now begin with the micturition reflex. It is one of the most important topics from this chapter. You can be asked several questions from this topic. आपको micturition reflex describe करने को भी पूछा जा सकता है और आपको इससे इसकी abnormalities के बारे में भी question किया जा सकता है. So let us begin with the micturition reflex. It starts when the bladder is filled with urine. When the bladder starts filling with urine, the urine stretches the walls of the bladder, and as I mentioned before, that the walls of the bladder contain specific stretch receptors, and these receptors are innervated by the parasympathetic nerve, which is your pelvic nerve, and it arises from the S2 S3 segments of your spinal cord. ठीक है, मैंने आपको पहले भी बताया था कि जो आपकी पैरासिम्पथेटिक नर्व है, पेल्विक नर्व, जो कि S2 S3 से अराइज करती है, इसमें बोथ सेंसरी फाइबर्स भी होते हैं और मोटर फाइबर्स भी होते हैं. और ये सेंसरी फाइबर्स बहुत इंपॉर्टेंट होते हैं मिक्चुरेशन रिफ्लेक्स के लिए, क्योंकि ये ब्लैडर के स्ट्रेच की फीलिंग की सेंसेशन लेकर स्पाइनल कॉर्ड की तरफ जाते हैं. सो इट बिगिन्स from here. When your bladder is filled with urine, it stretches the walls of the bladder, which are detected by the stretch receptors, and these stretch receptors send signals to the spinal cord through your pelvic nerve, which is your S2 S3 nerve. And now the spinal cord sends back impulses through the same nerve but its motor fibers. ये pelvic nerve जो आपकी S2 S3 है, इसी के अब motor fibers से spinal cord जो है वो signals भेजेगी to the bladder wall, and this is going to cause the constriction of the detrusor muscles. When the detrusor muscles will contract, the pressure within the bladder wall will increase, and it is going to push the urine towards the neck of the bladder and towards the internal sphincter. And as I mentioned before, when the neck of the bladder is stretched, it is going to send further signals to the spinal cord through the S2 S3 pelvic nerve, and this is going to send further signals to the bladder wall to cause further contraction. तो ये एक लूप शुरू हो जाता है जिसमें कंट्रैक्शन जो है वो आहिस्ता आहिस्ता स्ट्रॉन्ग होती जाती है. इनिशियली क्या होता है कि यूरिन के थोड़े सा डिस्टेंड यूरिन की प्रेजेंस की वजह से ब्लैडर वॉल थोड़ा सा डिस्टेंड होती है. ब्लैडर वॉल सिग्नल्स भेजती है टू द स्पाइनल कॉर्ड सिग्नल्स वापस भेजती है टूवर्ड्स द ब्लैडर टू कंट्रैक्ट. When the bladder contracts, it pushes the urine towards the neck of the bladder, or neck of the bladder is highly innervated by parasympathetic pelvic nerves. They again carry signals to the spinal cord, and again the spinal cord sends back motor signals for the contraction of the bladder, and this continues until the contractions are so strong that they are sent to your higher centers, and then your higher centers see that if the environment is appropriate, if there is availability of a washroom, then your higher centers send signal to your pudendal nerve, through your pudendal nerve to your external sphincter, and your external sphincter relaxes, and this causes micturition or emptying of the bladder. ठीक है. So if you want to revise, we can revise it again. What happens is, suppose this is your bladder, and this is the neck of your bladder, and here is your spinal cord, and your bladder walls and your neck of the bladder are supplied with sensory fibers of your pelvic nerve, which is your parasympathetic S2 S3 nerve. When urine starts to accumulate within the bladder, it causes the stretch of the bladder wall, and this stretch causes the impulses to be sent through the sensory fibers of the pelvic nerve to the spinal cord. Spinal cord in return sends sympathetic fibers to your detrusor muscles. The detrusor muscles contract, your bladder contracts, and the urine is pushed towards the neck of the bladder. And as I mentioned before कि यहाँ पर भी आपकी पैरासिम्पथेटिक नर्व सप्लाई जो है उसके सेंसरी फाइबर्स मौजूद हैं, और वो जब स्ट्रेच को डिटेक्ट करते हैं तो वो दोबारा सिग्नल्स भेजते हैं टू द स्पाइनल कॉर्ड, और स्पाइनल कॉर्ड दोबारा मोटर सिग्नल्स भेजती है टू द वॉल ऑफ द ब्लैडर, सो द ब्लैडर कैन constrict and push the urine towards the urethra. और ये कंटिन्यू रहता है ये साइकिल सेंसरी और मोटर इन फायरिंग का, यहाँ तक कि इतने स्ट्रॉन्ग सिग्नल्स जो हैं वो प्रोड्यूस होते हैं कि आपके हायर सेंटर यानी कि ब्रेन तक जाते हैं, और ब्रेन जो है वो देखता है कि अगर इन्वायरमेंट फेवरेबल है, आपका कॉर्टेक्स और आपका पॉन्स जो है बेसिकली वो सेंटर्स हैं, हायर सेंटर्स, जो कि जज करते हैं कि क्या इन्वायरमेंट फेवरेबल है, वॉशरूम अवेलेबल है, प्राइवेसी अवेलेबल है, क्या सोशली एक्सेप्टेबल इन्वायरमेंट मौजूद है टू वॉइड द यूरिन. और अगर ऐसी जो है वो इन्वायरमेंट मौजूद हो तो आपके हायर सेंटर से सिग्नल्स आते हैं टू योर पुडेंडल नर्व, जो कि आपके एक्सटर्नल स्फिंक्टर को रिलैक्स करती है, और जो ब्लैडर है वो कंट्रैक्ट करके एम्प्टी हो जाता है इनटू द एनवायरनमेंट. एंड अगर हायर सेंटर्स ये देखें कि फेवरेबल कंडीशंस मौजूद नहीं हैं तो वो एक्सटर्नल स्फिंक्टर को कंस्ट्रिक्टेड ही रखते हैं, और मिक्चुरेशन जो आपका ये रिफ्लेक्स है ये थोड़ी देर के लिए इनहिबिट हो जाता है, और अगली दफ़ा जब ये दोबारा एलिसिट होता है तो ये ज़्यादा स्ट्रॉन्ग होता है. ठीक है. और आहिस्ता आहिस्ता बार बार जब तक यूरिन जो है वो आपका ब्लैडर जो है वो एम्प्टी ना हो जाए ऑफ यूरिन, बार बार ये रिफ्लेक्स आता रहेगा, और जब भी ये नेक्स्ट टाइम आएगा तो ज़्यादा स्ट्रॉन्ग होगा, और अल्टीमेटली ये इतना स्ट्रॉन्ग होगा कि ये आपके हायर सेंटर्स को जो है फोर्स करता है टू फाइंड अ सिचुएशन और अ प्राइवेट environment where socially acceptable environment where the bladder can be emptied. So this is your micturition reflex. So the higher centers which are involved in micturition include pons and cerebral cortex. Pons जो है वो both stimulatory और inhibitory signals भेजता है आपकी external pudendal nerve को, and it can affect your sphincter in both ways. It can also cause inhibition of the sphincter. It can also cause relaxation of the sphincter according to the environment. जबकि कॉर्टेक्स जो है ये सिर्फ इनहिबिटरी होता है. जो कॉर्टेक्स से फाइबर्स आते हैं टू द एक्सटर्नल स्फिंक्टर दे आर मोस्टली inhibitory. So the higher centers, they keep the micturition reflex inhibited unless and until the environments are favorable. That's when your pons is going to send the signals to your external sphincter and cause it to relax, so that the micturition can take place. And this is how your higher centers control your micturition reflex. Let us now discuss some abnormalities of bladder. This is a very important topic because you might be given scenario based questions to attempt or to diagnose the type of abnormality which is present within the bladder. So before we begin with abnormalities of bladder, I need you to understand a little concept that your bladder sends signals to the spinal cord when it is filled and needs to be emptied. These sensory signals are carried by the parasympathetic nerve, and then your spinal cord sends signals to your bladder to cause constriction and emptying. And all of this is controlled by your brain, which keeps your micturition reflex inhibited mostly. ठीक है, तो this is the basic loop of what is happening within your body. So keep this in mind and let us discuss what abnormalities can afflict the bladder and how can they be diagnosed. First of all, we have the atonic bladder. Here we have the destruction of efferent or sensory fibers from the bladder. ठीक है, ये मैंने आपको जो बताया कि bladder से जो fibers spinal cord की तरफ जाते हैं ये damage हो जाते हैं. And now what is going to happen is that the bladder is going to fill up to its maximum capacity and it is going to stretch, लेकिन कोई भी stretch के signals जा नहीं पाएंगे from the bladder to the spinal cord because the pathway which carries the signals from the bladder to the spinal cord are damaged because of any disease. It can be syphilis. Syphilis is a sexually transmitted disease which can affect the sensory nerves of the bladder, and this is known as टेबिस डॉर्सैलिस. ठीक है, तो एक कंडीशन जो है वो सिफिलिस है या कोई और कंडीशन जिसमें सेंसरी फाइबर्स पेल्विक नर्व के डैमेज हो जाएं, तो अब ब्लैडर जो है वो फिल होता जाएगा, स्ट्रेच भी होगा, लेकिन यहाँ से कोई स्ट्रेच के सिग्नल्स स्पाइनल कॉर्ड को नहीं जाएंगे और मिक्चुरेशन रिफ्लेक्स जो है वो शुरू ही नहीं होगा, इलिसिट ही नहीं होगा. तो इसमें क्या होता है, ब्लैडर की कंट्रैक्शन नहीं होती क्योंकि जब तक स्पाइनल कॉर्ड को स्ट्रेच की सेंसेशंस नहीं आएंगी स्पाइनल कॉर्ड ब्लैडर को कंस्ट्रिक्शन की कमांड नहीं भेजेगा. तो जब स्ट्रेच की सेंसेशंस ही नहीं जा रही तो मोटर कंस्ट्रिक्टर फाइबर्स भी जो हैं वो नहीं कंस्ट्रिक्शन करवाएंगे ब्लैडर की, जिसकी वजह से ब्लैडर जो है वो फ्लैबी हो जाएगा और बिल्कुल उसकी टोन ख़त्म हो जाएगी. एंड इट वुड बी like a balloon filled with water, so the tone of the bladder would be lost and it will not empty periodically. Instead it will fill up to its maximum capacity and then urine will start dribbling from the urethra drop by drop, and this is known as overflow dribbling or overflow incontinence. अब मैं आपको दोबारा बताती हूँ कि this is the bladder, and when it is filled it sends sensations to the spinal cord, and spinal cord sends back motor signals for the bladder to contract. But if due to any condition, especially during syphilis, due to syphilis, if the sensory nerve fibers are damaged, no signals will be sent to the spinal cord, and spinal cord will send no signals back to the detrusor muscles to contract. So there will be no periodic micturition reflex, and there will be no periodic emptying of the bladder. The bladder will fill up to its maximum capacity and it will be flabby, and what will happen is that when the bladder is filled up to its maximum capacity, drops of urine are going to come out of the urethra, and this is known as overflow dribbling or overflow incontinence. and it is due to the maximum filling up of the bladder and overflowing of the bladder. ठीक है, तो दिस इज़ नोन एज एटॉनिक ब्लैडर. ब्लैडर बिल्कुल एटॉनिक और फ्लैबी हो जाएगा क्योंकि उसको कंस्ट्रिक्शन की कमांड ही नहीं आ रही फ्रॉम द स्पाइनल कॉर्ड, और वो पूरा मैक्सिमम कैपेसिटी को फिल होगा और उसके बाद उसमें से ड्रॉप्स जो हैं यूरेथ्रा से पास होना शुरू हो जाएंगे. दिस इज़ नोन एज ओवरफ्लो ड्रिबलिंग. सो द सिनेरियो वुड बी दैट अ पर्सन हु इज़ सफरिंग फ्रॉम sexually transmitted disease cannot hold his urine, and it is always dribbling in the form of droplets from his urethra, and you will be asked to diagnose the condition, and you can diagnose it as the atonic bladder. So next we have the automatic bladder. In the automatic bladder, the spinal cord is injured above the levels of S2 and S3. Your S2, S3 segments are spared. ठीक है, ये जो S2 और S3 हैं ये बिल्कुल ठीक हैं, लेकिन इसके ऊपर जो है वो स्पाइनल कॉर्ड वो इंजर हो चुकी है. तो इसमें क्या होता है कि आपके सेंसेशंस जो हैं फ्रॉम द ब्लैडर टू द S2 S3 आर वर्किंग ऑल राइट, यानी कि सेंसरी रूट जो है ये बिल्कुल ठीक है. दे कैरी सेंसेशंस ऑफ फिलिंग फ्रॉम और स्ट्रेच फ्रॉम द ब्लैडर टूवर्ड्स द स्पाइनल कॉर्ड. In return, the spinal cord sends signals of motor signals for the contraction of the bladder from the S2 S3 towards the bladder. So as you can see from here, your micturition reflex is absolutely fine. ठीक है, ये stretch को भी sensations carry कर रहा है from the bladder to the spinal cord, और ये motor reflex भी लेकर आ रहा है from the spinal cord to the micturition to the bladder to cause constriction. But the control of the higher centers from the brain and the pons, from the cortex and the pons, cannot reach the spinal cord because of the destruction of the higher levels of the spinal cord. So such bladder is free from the control of the brain. The micturition reflex is present but cannot be controlled by the brain. अब जब भी स्पाइनल कॉर्ड इंजरी होती है तो उसकी दो स्टेजेस होती हैं. पहले स्टेज को स्पाइनल शॉक कहते हैं. ठीक है, व्हेन एवर द स्पाइनल कॉर्ड इज़ इंजर्ड, first few weeks are known as the time period of spinal shock. During spinal shock, almost all of the functions of the spinal cord are lost above and below, and the bladder becomes flaccid during this time. Why? Because during this time period of spinal shock, the motor signals are not being sent to the bladder, and the bladder becomes flaccid and non-responsive. And during this time, you have to empty the bladder with help of catheters. ठीक है, यूरिनरी कैथेटर पास करके ब्लैडर को एम्प्टी किया जाता है, क्योंकि इस टाइम पर स्पाइनल कॉर्ड अभी अभी इंजर हुई है और अभी स्पाइनल कॉर्ड शॉक में है, जिसको स्पाइनल शॉक कहते हैं. सो इट्स सेंसरी एंड मोटर फंक्शंस आर डिसरप्टेड. लेकिन आफ्टर द स्पाइनल शॉक सेटल्स डाउन, आफ्टर अ फ्यू वीक्स, व्हाट हैपेंस इज द रिफ्लेक्स रिटर्न्स, and the reflex can take place, as I have already mentioned, that it can also receive the stretch signals from the bladder, and it can also send the motor signals to the bladder to contract, but it has been severed up above the level of S2 and S3, and it cannot receive the inhibitory signals from the brain. So your micturition reflex is no longer under your conscious control, and the bladder evacuates unannounced. ठीक है, there is no control of pons and the cerebral cortex, और ब्रेन ये कंट्रोल नहीं कर रहा होता कि क्या सोशली एक्सेप्टेबल है ब्लैडर को इस टाइम पे इवैक्यूएट करना. तो ब्लैडर जब ये कंट्रोल ख़त्म हो जाता है ब्लैडर के ऊपर से, तो मिक्चुरेशन रिफ्लेक्स खुद जो है कंट्रोल करता है एम्प्टिंग ऑफ द ब्लैडर, एंड देयर इज़ नो इन्वॉल्वमेंट ऑफ द ब्रेन, जिसकी वजह से अनअनाउंस्ड इवैक्यूएशंस हो जाती हैं, अनअनाउंस्ड मिक्चुरेशन हो जाती है, even at the times which are not socially acceptable. So this is the automatic bladder. और इसमें जो है आपको सिनेरियो क्या आएगा कि suppose there was an accident and the patient is suffering from damage of the spinal cord above the sacral region. So what are going to be the features of this person's bladder, और या फिर ये किस किस्म के bladder abnormality से suffer कर रहा है, तो you will mention the automatic bladder. So now let us move on to the third type of bladder, which is known as the uninhibited neurogenic bladder. So in this kind of neurogenic bladder, there is no damage to the spinal cord. In fact, the damage lies at the area of pons or higher centers such as the cortex. अब इसमें होता क्या है कि द स्पाइनल सेगमेंट्स S2 and S3 आर एब्सोल्युटली फाइन. They can receive sensory signals from the bladder and can also send the motor signals to the bladder for contraction without any problem. The only problem is that these facilitatory signals are not under the check and balance of the higher centers like the pons and the cerebrum, and they are not inhibited. अब हर टाइम जब भी ब्लैडर के अंदर थोड़ा सा भी यूरिन एक्यूमुलेट होगा और वो थोड़ा सा भी वॉल्स को स्ट्रेच करेगा, तो यहाँ से सेंसरी सिग्नल्स जाएंगे टू द स्पाइनल कॉर्ड, एंड द स्पाइनल कॉर्ड इज़ गोइंग टू सेंड बैक स्ट्रॉन्ग सिग्नल्स फॉर द कंट्रैक्शन, एंड दीज विल नॉट बी इनहिबिटेड बाय द हायर सेंटर, एंड दिस विल ऑलवेज रिजल्ट इन मिक्चुरेशन इवन दो द क्वांटिटी ऑफ यूरिन इज़ वेरी लेस. तो थोड़ा सा यूरिन भी एक्यूमुलेट होने से जो मिक्चुरेशन रिफ्लेक्स है वो इलिसिट हो जाएगा और वो इनहिबिट नहीं होगा बाय द हायर सेंटर्स. सो द सिनेरियो विच यू आर गोइंग टू रिसीव इन सच केस इज़ दैट अ person who is suffering from stroke or ruptured aneurysm in the brain or bleeding within the brain or the cortex passes small quantities of urine after some time, and after the micturition reflex is elicited after small durations of time. थोड़ी देर बाद ही वो urine pass कर रहा है, and the quantity of urine is very little. And what kind of bladder is this person suffering from? So आपको पता चल जाएगा कि higher centers जो हैं अगर वहाँ पर damage है और मिक्चुरेशन रिफ्लेक्स जो है वो बहुत थोड़ी देर बाद रिपीट हो रहा है और बहुत स्मॉल क्वांटिटीज़ ऑफ यूरिन है, तो आपको पता चल जाएगा कि दिस इज़ अनइनहिबिटेड न्यूरोजेनिक